Hello, everybody, and welcome to another episode of the Professors of Profit vlogcast. I'm your host, Dr. F Scott Feil, PT educator. I'm here with a very interesting guest this week. I'm here with Dr. Singh, who actually does board exam coaching and board exam tutoring for students looking to take the NPTE, or the National Physical Therapy exam. Dr. Singh, thank you so much for taking your time out to come on and chat with us a little today. Could you tell us a little bit about your business and your area of expertise?
Great. Thank you so much for inviting. My name is Dr. Bhupinder Singh, and I am a licensed physical therapist. And my main focus for this podcast is I am the lead instructor for NPTE Final Frontier, which is a coaching program designed specifically for DPT graduates to pass the National Physical Therapy examination. We have been in formations since 2015, and we usually get about 800 to 900 students a year to take the NPT with us and pass the exam. My professional background, in addition to being a licensed physical therapist, is I am a PT PhD, which means I went to school for PhD in physical therapy and rehab sciences at the University of Iowa. And I'm in my current other role, also work as an associate professor in California State, Fresno, in the DPT program since 2013.
Man, I love to hear that. I love to hear people doing multiple things at the same time and juggling several different streams of income. So I love to hear that. I kind of wish you were around back when I took the exam back in 05, 06. It took me a handful of times to pass it. So I don't think the test reviews were up to par back then. So it's good to see there's some options out there now for sure.
Yeah, thank you.
Dr. Singh, tell me a little bit about, do you think that healthcare academicians or clinicians could kind of do some of the things you're doing? What are some of the pros and cons to what you're doing currently with the board exam coaching and mentoring?
Yeah, great. So I think it's going to be a person-specific question. My vision when I was a licensed PT was to enhance my research and my evidence-based practice. But I quickly realized when I started teaching in the DPT program as full-time that there was a missing link between a quality course for our NPT candidates. Like when you go to DPT program, you take cardiopulmonary. And for example, I teach gait analysis as a specialty course. But we have all these DPT students who are like taking all these great courses from great professors in DPT school, becoming experts of cardiopulmonary, neuromuscular, and musculoskeletal. But the moment they graduate in May, which is mostly when DPT programs graduate, they don't know how to put everything together in 3 months and take the exam and pass it. And that's their only chance to become licensed. It's like a wall between them and patients. They can't touch the patient without they pass it. So my role as a healthcare professional in a DPT program certainly changed vision, where I was like, there's no point working with all these people if they can't pass the license exam. They can be the best clinicians I could ever produce with hands-on skills, but if they don't get the license, then they are stuck. And I think from academician point of view, someone who went to school to become a researcher and a teacher after being a clinician, like doing the 3 hats of clinic, research, and teaching together, teaching the board prep became almost an automatic vision to reach more and more people. Like I could teach 32 people, that's our class size in the DPT program, in about a semester or 2 semesters. But if I wanted to reach the bigger audience, I had to do something like this. So if you are thinking about expanding, obviously it's going to be a side hustle for beginners, but it is possible if you pursue the passion from what your main job is, which could be a clinician or an academician, or both of them in my case. So just pursue the passion and then go for the next step.
Yeah, you hit the nail on the head there. All of my side gigs, I probably put in 20 to 30 hours a week on just side hustles alone, but I love them so much. They are passion projects, so I don't mind working on them. I love that stuff.
Right.
And I love physical therapy too, right? I love teaching. I love practicing in the clinic and getting my hands on patients, but I just love my side projects and my side hustles more, I think. So I think you hit the nail on the head. It has to be passion. And, the more I think about it, That doesn't just apply to PT students. I mean, let's look a little further up the list. It could be specializations too, right? Because,
Right.
you have people taking the orthopedic certified specialty or geriatric certified specialty or a pediatric, et cetera, et cetera. There are many different specialty certifications. People need help passing those exams too, because I don't think it always kind of equates to how good of a clinician you are. It has some test taking bits and pieces to it as well. You have to be a decent test taker, which I was not. So I think coaching, how to take tests and how to manage those things are a big part of it too. And that, like I said, could even go as far up as specialty certifications as well. So it's
And
really
I think
interesting.
the one thing which I would add to someone starting to do it, obviously your experience and you've done it so many years, is first check off the list on your main job, right? So when I started teaching in the DPT program a few years back, I knew that I had to get tenured, which is my big goal. And usually we get tenured at 6 to 7 years being a professor, but state universities sometimes give exceptions. So I made a goal and say, if I want my side hustle to go bigger, I need to first check off the list of being tenured,
Yeah.
and then I can spend a little bit more time.
Yeah.
And so anyone who's trying to go for it, I think I achieved tenure at 4 years, which was very early at
Yeah.
that
That's
time.
amazing.
And then it helps you grow your passion a little bit more because there's a steady source of income from your main job, and then you can do other things.
Yeah, exactly. I had to kind of pull back on all of my side projects and side hustles about 2 years ago when I finished my educational doctorate. I was working on
Yeah.
my dissertation for my EDD, and it just got to be too much. I couldn't do anything else but focus on that. I was doing it while I was working a 9 to 5, which was not fun, but I was burnt out, man. That dissertation kicked my tail. So I think you're definitely right that there's times in your life where you have to prioritize things and get them checked off first. But once you check those boxes, and I talk about this in my book a little bit, if you want multiple revenue streams, that's totally fine. You can do that, but you've got to have one up and running first. Once that's going, then you can move on to the next one and get that one up and running. Then move on to the next one. Otherwise, you fall symptom to that shiny object syndrome where you're just, grasping at straws. Oh, I can do that. Oh, I can do that. Oh, I want to do that. Oh, that looks cool, and you got no rhyme or reason behind it. You're going to fail. You're going to flop.
Yeah, exactly. Great points.
Well, Dr. Singh, I can't thank you enough for all your time and for coming on and just giving our audience a little bit of an insight as to, coaching and mentoring people through the board exams and through specialty exams and things like that. Where can my audience reach out to you and contact you if they have further questions or they just want to chat and find out more about your business and whatnot?
Yeah, so it's pretty easy because the name of the exam is NPTE, and our company is named NPTE Final Frontier, and our logo is "Let's make your next attempt your last attempt." So if you go to our website, which is npteff.com, and then just go to the contact information, you can reach out to us. We have a team of 28 people, full-time, part-time working, and we have a full-time business manager and a few professors who are teaching for the course. So their content questions we can answer for you, but if you have any questions about enrolling, you can email at enrollment at nptefinalfrontier.com. And if you have questions for me and pursuing something, not only for board exams, but thinking about other professional careers and owning clinics, or maybe doing some other stuff which can help build that evidence-based DPT practice for our future clinicians, I'll be happy to answer them. My email is Bhupinder, which is BHUPINDER at nptfinalfrontier.com.
Awesome. Thank you so much for your time. I'll put all those links in the show notes so that people can find them easily. Thanks so much for pushing the profession forward and doing things above and beyond and juggling several tasks at once, because it can be done.
And it's a lot of fun.
Yeah, exactly. Exactly. Thank you so much for your time, Dr. Singh.
All right. Have a great day.